Valium and Xanax are in the class of drugs known as benzodiazepines. These medications help control anxiety, panic attacks, and insomnia, but they're habit-forming and have some dangerous side effects. Dr. Renette Lev directs the emergency department at San Diego's Scripps Mercy Hospital. She often sees the downsides of benzodiazepines.
That comes from people who come into our trauma center with car accidents because they're on benzodiazepines. People who come in because they're falling down, because that affects their balance and coordination on benzodiazepines. We've seen terrible withdrawals when they are used to having it, with seizures that end up in the ICU.
Lev says when it comes to drug-related deaths in San Diego County, benzodiazepines are right behind opioids.
Number one prescribed drug associated with deaths is oxycodone, then hydrocodone, then number three, benzodiazepine.
Nationwide, between 2002 and 2015, the number of deaths involving benzodiazepines more than quadrupled. Nathan Painter is an associate professor of pharmacy at UC San Diego. He says these drugs can be risky, and when taken in combination with opioid painkillers, deadly.
So the benzodiazepines themselves can cause respiratory depression or your breathing to slow down, and so can opioids. Opioids to a much more extent. So when you combine them, especially in the case of not using them on a regular basis or being new to the benzo or the opioid, and if you give too much or you combine it with other things like alcohol or other medications, then it can cause that breathing to slow down or even stop.
The San Diego County Medical Examiner found in 2016, 83% of the people who suffered a benzodiazepine-related death also had an opioid in their system. Painter says even when taken as directed, benzodiazepines and opioids can be a lethal mix.
Because both of them independently can cause problems, and a lot of times the physicians that are prescribing them aren't necessarily aware of all the drugs that are already on board, and may not be as conservative or as slow in starting the medicines as without that knowledge.
The Veterans Association healthcare system is trying to address these problems. Internal medicine specialist James Mickelson is chair of the San Diego VA's Pain Council. He says many veterans have conditions that would typically call for both a benzodiazepine and an opioid.
Anxiety related to their combat time, problems with sleep, post-traumatic stress disorder, and traditionally these conditions, benzodiazepines have been used to treat. Additionally, many of our veterans came back with physical wounds as well.
But Dr. Mickelson says the VA is aware of the dangers and is making a concerted effort to scale back the co-prescribing of opioids and benzodiazepines. For example, if a patient is already taking an opioid and their doctor wants to add a benzodiazepine to the mix, a warning pops up on the computer doctors use to write prescriptions. Mickelson says over the past 2 years, the VA has made a 40% reduction in the number of co-prescriptions. He says the VA is also targeting benzodiazepines on their own.
10 years ago, the thought was benzodiazepines could help quite a bit with symptoms. And they do in the short run. People feel better when they take it, get a temporary relief. But in the long run, the benzodiazepines turn out to not help the condition very much and potentially can even be harmful. But now we have quite a few patients on benzodiazepines, and we have to start reeling those prescriptions back.
But the VA is facing a big challenge. 70% of their patients also get care from outside doctors. Scripps Mercy's Renette Lev says the way to reduce benzodiazepine-related problems is to set up a barrier to prescribing them.
And by that I mean health plans and government paying for these medications. If they put stricter controls, then we would have less access.
But that wouldn't be easy. Benzodiazepines are among the most widely prescribed drugs in the U.S. And according to the San Diego County Prescription Drug Abuse Task Force, there's no shortage of them in our region. The task force says in 2016, local pharmacists sold more than 37 million benzodiazepines. Kenny Goldberg, KPBS News.